would like to thank our seminar supporter, Mitsubishi Tanabe Pharma America, for supporting this seminar. We would not be able to provide these educational programs without the support of our generous partners. Welcome to all of those that are joining us. Thank you for being here for day one of our Technology for Independence seminar. My name is Marissa Lozano. I'm the Director of Community Education at MDA. And we are so pleased that you've joined us for this robust and dynamic seminar. Today's seminar is part of our larger MDA Engage Community Education series, which focuses on providing relevant and responsive information for the neuromuscular disease community from subject matter experts. Be sure to visit the MDA Engage section on mda.org for updates on our upcoming virtual education events. We would not be able to provide these educational programs without the support of our generous sponsors. So I'd like to thank Mitsubishi Tanabe Pharma America for their support of this seminar today. Just a few housekeeping items to go over before we begin the seminar. We are recording today's event and we'll be posting it to MDA's website for on-demand viewing. You will receive an email when the recordings are available. We will be having a question and answer session at the end of each presentation. Please know that all phone lines have been muted. We encourage you to type your questions into the Q&A box that's found on the bottom right of your screen. You can click on the three small dots and select the Q&A option. A box then opens up for you to type your question. You don't need to wait until the end of the presentation to enter your question. As questions come up in your mind, please feel free to type them in, and we will get to as many questions as we can at the end. We also want to encourage you to communicate with others by utilizing the chat feature. If you want to say hi, share a bit of your story, or have a question about something outside of the topics we'll discuss today, please feel free to use the chat feature that's also located on the bottom right of your screen. So here's the agenda for today. We are going to get started with a presentation on the essentials of assistive technology, followed by a presentation about smart homes, and then a presentation about Abilitech Assist, which is an exoskeleton device that you will learn more about. And then we're going to conclude with just a little bit about MDA at the end of the day today. We will be sending out a brief survey at the end and would love for you to give us your feedback on what you've heard. We strive to discuss topics that are of interest to you, and we use your feedback to improve our educational programming. So thank you in advance for giving us some of your feedback. So let's review the objectives for today's seminar. We're here to provide information from leading experts on a wide range of technology that supports independence. We want to make sure that we're demonstrating meaningful ways that technology can be used in all areas and all settings of your daily life. And lastly, we want to share resources to help you access technology that you might need or that your loved one might need. So now it's my pleasure to introduce our first session of the day. The presentation Assistive Technology Essentials will be given by Thomas DiAgostino and Alanna Raffel from TechOWL, Technology for Our Whole Lives, a program with Temple University's Institute on Disabilities. Alanna graduated from Thomas Jefferson University with a Master of Science in Occupational Therapy and from Temple University with a Post-Professional Occupational Therapy doctorate. Alanna has worked as an occupational therapist for almost 10 years in a variety of settings, including acute rehab, outpatient, and in schools. Alanna now works as an assistive technology specialist at TechOWL, the Assistive Technology Act program for Pennsylvania, which is housed at the Institute on Disabilities at Temple University. She enjoys making things using all kinds of fabrication tools and materials, including 3D printing, sewing, and silicone molds. She's passionate about disability justice and inclusion in all facets of life. Tom is the Outreach and Training Coordinator at TechOWL. Before starting at TechOWL in 2019, Tom completed a Fulbright Fellowship in Uruguay. Additionally, Tom was a social worker and Spanish interpreter in the child welfare and foster care system in North Philadelphia. As a person with dyslexia, Tom is passionate about readability and website accessibility. Tom co-leads the social media platforms and the fabrication program called Create Together, as well as maintains the TechOWL website. Outside of Tom's role at TechOWL, he also is an adjunct professor of Spanish, Latin American Studies, and Gender, Sexuality, and Women's Studies, instructing courses on immigration, race and diversity, Spanish language, feminist theory, and radical social movements. Alanna and Tom, thank you for sharing your time and your incredible expertise with us today. I will go ahead and turn the floor over to you.
Great. Thank you so much for having us, and thank you to everyone for being here. Can you give me a thumbs up if you can hear me okay, Tom? Cool. Okay. Awesome. All right. Let me share my screen and we can get started. All right. Hi, everyone. So we're really excited to share this information with you. As Marissa mentioned, we are based in Philadelphia. So while some of the things we're sharing may be sort of Philadelphia or Pennsylvania centric, we did our best to kind of open up the information so that it's more, fits to all of your needs and locations. But you may notice we'll mention some things that are Pennsylvania based, and in which case we'll always try to offer other resources in your area. But feel free to yell at us if we're talking too much about Pennsylvania. So yeah, we'll get started. So today we're going to be doing basically an overview of some assistive technology information, and then we'll talk about some of the programs that we have at TechOWL, as well as the programs that are housed at all of the assistive technology programs across the country. This is our logo. It says TechOWL, Technology for Our Whole Lives, Institute on Disabilities at Temple University, and there's a little owl. Temple University's mascot is an owl, and so it's sort of cute for that, but also OWL stands for Our Whole Lives, so double meaning here. So thank you, Marissa, for this introduction. This is us. I'm wearing a shirt here that says the future is accessible, and as Marissa mentioned, I'm an OT by background, but I work with assistive technology now, and it's been a really wonderful transition for me. And here's Tom in Uruguay. Tom, is this where you are?
That was Peru.
Oh, Peru. I always forget. Drinking mate? Is that?
Yeah.
Cool. Well, I'm learning all the things. So today we'll just talk a bit about AT devices and services, about the continuum of assistive technology, identify who can benefit from AT and what's out there, what's available, and then understand how to use our lending library and our programs if you're in Pennsylvania, or the programs in the lending library in your state. All right, Tom, you want to give them a little background?
Great. Yeah. So a little bit about TechOWL as a program. We are the Assistive Technology Act program for the state of Pennsylvania. As Alanna said, TechOWL stands for Technology for Our Whole Lives, because we wanted to rebrand and we wanted to reflect Temple University and their mascot. But our previous name is called Pennsylvania's Initiative on Assistive Technology, or PIAT. So in our state, a lot of people who have been in, the disability community and who have worked with people with disabilities for a long time remember our previous name. And so we always just include this little slide in case someone recognizes PIAT. We're the same organization. We do the same things. We just did a little rebranding. TechOWL is part of the Institute on Disabilities at Temple University. So we are housed within an institute, which is really lovely. And so we are the Assistive Tech Act program for the whole Commonwealth of PA. It's important to know that there are 56 Assistive Technology Act programs in the United States. So every state and territory of the United States has an AT Act program. So we're just the Pennsylvania flavor, but if you're in Arizona, there's an Arizona program. If you're in New Jersey, there's a Jersey program. If you're in the Virgin Islands, there's a Virgin Island program. So our main task as an AT Act program is to connect people to assistive technology resources in their area. And many of us share very similar programs, which we're going to talk about some of our programs in this presentation. Oftentimes, they're very similar. Oftentimes you'll find that an AT Act program has a lending library. They often do demonstrations of devices. They'll do trainings just like this one. They will do presentations for groups as well. Oftentimes they'll do something called technical assistance, so like more detailed help for organizations. And general assistance. Everyone typically has a website and a phone number, so you can call them with questions. I have two brand like logos on the screen. One is the AT3 Center, the other one is ATAP. Both of these organizations coordinate with all of the ET Act programs. And so if you want to learn more about the national kind of like aspect of the ET Act programs, I highly encourage you to go to both of their websites and check them out. If you're curious to find out your state program, please go to at3center.net/state AT program, or you can just Google search, find my Assistive Technology Act program, and you'll find the link right there. And then you could go through all of the states.
Yeah, so about TechOWL, we are a federally funded nonprofit organization, just like most of the state AT Act programs. We view disability through social and holistic models, so a bit different than a lot of my experience as a practicing OT, which sometimes was kind of in that medical model framework where we were looking at like, okay, what does this person need to learn how to do in order to participate in work or whatever. This is very much through the social model of disability, like what do we need to change about the world or your environment, or what do we need to provide so you can participate more independently and or safer. We really believe in a user-centered experience, so we're always trying to help people feel empowered, educated, and informed about what assistive technology is out there so they can make their own decisions. Really, ultimately, it's up to them. This is a photo from a meetup of people that use communication devices. We do a lot of work around communication, and so this hasn't happened in person in a while, but back in the day, there were a lot of communication meetups for folks who use AAC, augmentative and alternative communication, so they could hang out and share. So that's a little bit about TechOWL. As Tom said, we have many, many different projects and programs that are changing all the time. We'll talk more about all of these in other slides, but here's a quick photo. There's Tom. This is before I joined the team, so I was not invited to this outing, but there's Tom with our colleague Julianne, who's blind, and she's a blind and low vision expert with her guide dog Bob, and our colleague Katie, who runs the lending library. This may not apply to you if you're not in PA, but for reference, we around the state have assistive technology resource centers. So we do a lot of work in Philadelphia and in this 5-county region in this area, but we also have resource centers across the state. And we do that so that people are getting the resources they need local to them. I think depending on different state programs, some may also have this kind of model, or some states I think are based in one place and are kind of getting things everywhere. But we're trying to ensure that there are resource centers across the state, so folks like in Pittsburgh and Scranton don't have to, deal with us in Philly as much. They can kind of coordinate and collaborate with folks in their area. All right, so a little bit about just assistive technology generally. And for some folks, this might be like basic and all this, and for some people, AT might be a totally new thing. And so we'll start sort of at square one, and we'll just kind of glide through a bunch of stuff about AT. But please know that we're always happy to answer questions, and even after this presentation, we can email, we can chat, and we're always happy to share more ideas. So when we're thinking about assistive technology, we're thinking about both AT devices, so all the stuff, whether it's like purchased commercially from a website, from a catalog, from a store, whether it's modified, customized, anything that helps a person with a disability improve or be able to participate more independently, be able to participate or do something safer, be able to do it easier, with less pain, with less fatigue, anything that helps a person with a disability do something. Of course, we know technology generally assists, like that's what technology does. It assists us. So assistive technology is really just the word for like stuff that helps people with disabilities do stuff. And you'll see that, assistive technology is starting to more and more blur the lines between generic and assistive specialized technology. And we like that that's happening. And then there's AT services. That's all the stuff and all the kind of things that happen around AT. That's not the stuff. So it's like evaluating for assistive technology, making sure you know how to use it, making sure your family can use it, training people, working with your OT or your other allied health folks to make sure that they know how to use it, making sure it gets fixed. You know, wheelchair repairs are a really big issue that we've been dealing with a lot. So all of that, all of those services that go along with AT are a really important facet of our work as well. Tom, you want to share a little bit about the continuum?
Cool. So we are going to kind of like go through step by step what we call the assistive technology continuum. We want to just say, like, take this with a grain of salt. No matter where you turn online, you're going to find people having different definitions of this. We like to just call this a bit of a framework, not like a tried and true fact, but it's an interesting way to think about assistive technology and how it reflects our needs. So the first category is really, we're calling it light tech. So we kind of categorize this as anything that is free or inexpensive or relatively available and does not require a lot of training or ongoing support. So on the screen, we have an image of a cup with a straw in it. So for some people, a straw, you know, is a thing that we all have, but like also can be very assistive and can help someone access their drink if they're unable to like bring the cup to their mouth. Or drink from the cup without a straw. So sometimes we'll find the term no tech as well in this category, but we think that all things are tech. There's nothing that's not technology. We also have a piece of paper, which is a communication board, right? And so it's not anything high tech. It's not, there's no batteries in it. It's just a piece of paper with icons on it that we can point at to communicate. We also think that slanted clipboards, post-it notes, pencil grips, these are all things that are kind of like light tech that can really help someone access either a pencil or remembering an idea or having their paper closer to them in like a more ergonomic way.
Yeah, and then we have the mid-tech stuff. This is stuff that we sort of in between. Maybe you could get it at like Amazon or Best Buy or Target, something like that. Maybe it's like more than $50-ish, or even, I don't know, more than 30 or whatever, but less than like a couple hundred. It's in that mid-range. Maybe it requires like a little bit of practice and training, but not a ton. Maybe it's a little bit more sophisticated. This category, I think it can be kind of gray, but some things that might be in this mid-tech category are things like a GoTalk, which is a kind of communication device that doesn't have a ton of control. It's not like a communication device you might see on like an iPad or, you know, a speech generating device where you could change all the words and have special, you know, all of these special pages and things like that. This is just a paper that slides in, you can press the buttons. It works for some people, but it's more basic than those sophisticated communication devices. Maybe like an ergonomic keyboard or an ergonomic mouse or something. And then maybe something like an audiobook or noise canceling headphones or things like that might be considered mid-tech.
And then we have high tech, which I think this is like the thing that we think about when we think of assistive technology. So probably the easiest category to describe. Thank you, Alanna, for letting me describe this one. So this is generally like very expensive. From what I've seen on the docket of presentations that are to come for this, you know, conference, it's a lot of very, very high tech and expensive devices that you're going to be witnessing. So get ready for this kind of category. So typically they're very expensive. They also oftentimes require significant training and ongoing support. So that service piece of assistive technology, working with your allied health and OTs and PTs, very important. And they're usually super sophisticated. So on the screen, we have items like a tablet with a refreshable braille display or just the refreshable braille display itself. We also have a tablet, which would be a communication device. I believe that device also has an eye gaze attached to it, so you can use your eyes to control the screen versus a stylus pen or a mouse. You know, motorized wheelchairs are oftentimes very expensive and they require a lot of ongoing support. Additionally, any type of computer access method, like on the lower right side of the screen, we see a head tracking mouse, which is just an apparatus that gets put on top of the computer, plugs in, and then you can kind of use your face and facial expressions to control the mouse.
Yeah, so we'll just do a quick little example so you can see a bunch of different stuff for painting that might span all of these categories from light tech to high tech. So I'm going to go through them quickly. So we have like a built up handle on a paintbrush that's made out of a pool noodle. This is a 3D printed little ring where you could attach a paintbrush to this 3D printed ring. Pretty light tech stuff, nothing major. Ergonomic brushes that you can purchase. These are called easy holds. It's this little silicone device that you can connect like a paintbrush, a toothbrush, a pencil, whatever. They come in all different sizes. That's pretty light tech too, pretty inexpensive. Doesn't require much training. Then we get into a little bit more complex stuff, maybe like a specialized easel at a certain angle. This painter is also using a universal cuff that is attached to her paintbrush. Maybe a device like guided hands, which we have in our lending library and we really love. This device has a lot of 3D printed parts actually, and it stabilizes your hand. It has a lock line where you can attach a paintbrush or a stylus or a pencil or something, and you can really hover your hand and move it in 2 axes to paint or write or do something. That's kind of like a mid-tech thing. It's a little bit expensive, requires a little setup, but not super fancy. Things like a head stick might be kind of that in between. But then we have some probably pretty expensive stuff like a big paint roller that could attach to a wheelchair, or this device which is called Glasshouse, a glasses mouse. And this person who's also painting, I think in that middle photo there, she's using this device to do eye tracking on her computer to do some like digital design, and then she uses the mouthpiece to click. So that's very fancy, very high tech, probably pretty, I forget how much it costs, but probably fairly expensive and requires a lot of practice. So that's just one example of an activity kind of spanning that continuum.
I think the conclusion of this whole conversation of this AT continuum is not, oh, what part of the continuum do I fit, but does the assistive tech fit my need? So our ultimate goal as an AT ACT program is to find the most appropriate tool regardless of where it falls on the continuum, right? To address that person's need. Something to know about just AT ACT programs in general is that we are device agnostic. Since we are a federally funded nonprofit organization, we are not being sponsored by anyone to promote a device. And so if you're looking for an unbiased perspective, I think a really great first step is to contact your local Assistive Technology Act program, regardless of what state you're in. None of us are corporate sponsored, and we're not promoting any specific device. We really do want to find what works best for you and your needs.
Yeah. All right, so I'm just going to go through a bunch of different tools that we have at our lending library. They may or may not be housed at your lending libraries in your states, but just to give you some ideas of what kinds of things we have. So we have things like ergonomic garden tools. By the way, this category is all about moving and controlling. So moving your body, controlling the environment with your hands and your arms. This is guided hands, which I mentioned before. It's this device that allows you to write or use a stylus on an iPad. We have certain utensils. This one's the Liftware level spoon that helps balance a little bit. It has some self-leveling mechanism, and it kind of makes sure that the spoon is always in place and doesn't fall over. Sometimes generic things like kitchen tools, like an automatic can opener, jar openers, those things can be assistive technology. We have this electric nail clipper, which actually has been really helpful for some folks. We have one-handed cutting boards. This cutting board has a device where you can kind of put your vegetable, your fruit or whatever in a vise so it stays, or there's these little pegs it can sit on. We have things like the Xbox Adaptive Controller, which has all these switches and triggers that you can use more independently than you might be able to use a regular Xbox controller. The Easy Hold cuffs, like I mentioned, smart home devices are a great generic tech option for environmental control. And then all their kinds of feeding tools like the OB dining robot, which is a pretty impressive and functional device that has 2 switches that allows you to use this robotic spoon to pick up food from the bowl and bring it to your mouth. You can basically train it the right angle and where your mouth is so that you can feed yourself more independently using these 2 switches. It's a very cool device.
So we have some alternative computer tablet access methods. First being an ergonomic keyboard. There are so many different types of ergonomic keyboards out there. We have several. That is if I'm not mistaken, a chin mouse.
I think, yeah, is she using a chin mouse and a head mouse? Like a chin switch and a head mouse, maybe?
Yeah, she's using multiple devices. We do have a chin mouse in the office, and we really think that it's a great tool for someone. Also, we have multiple different types of head mice that can either attach to like a headband or a cap, and some that are attached to the computer as well that kind of tracks your head. That is called a tippy keyboard, which is an ambidextrous, so it can flip for left or right-handed, one-handed keyboard. We also sometimes will 3D print key guards to cover a keyboard. We also have keyboards that have those key guards already established on them. That, I forget the name of it, is a head mouse.
That's the Abilitaire head mouse. I haven't tried it yet, but
I did try it. The Abilitaire, they did the demo with us. They were
incredible.
Yeah. And that kind of how he's wearing a headband, you can clip it onto a headband or a ball cap. That is a wrist mouse, so you're using your wrist and like different gestures to click. So there are also different types of iPads where you can use the iPad with multiple different accessibility features to connect to the internet. And that last one is actually with your hands, is a keyboard. You use finger combinations to type out letters, and the thumb piece is your click as well as your mouse.
Yeah, that's called the tap strap keyboard.
Tap strap, whoopsie, sorry.
Oh, and last one, we mentioned this head tracking mouse before, but that's a thing you could attach to a computer to do head tracking with your computer, so you could access it that way. For hearing and seeing, of course, hearing aids are considered assistive technology. We don't do anything with hearing aids, but maybe some other ATX programs do. This is the OrCam read, right, Tom?
That's the read, yes.
The read. So the OrCam device basically is able to scan text and read it out loud to you. I saw, actually, there's a video of Tom, of you trying this. Maybe we'll put that in the chat, but it was a very cool device to watch you. I saw you did a thing where you like just turned your wrist as like a gesture and it told you the time. That was that, right?
Yeah.
It's very cool. There's some other free apps that do this kind of thing, but for some folks, the OrCam read, whether it's for someone who's blind or has low vision, or for someone who has dyslexia or has trouble reading, this might be a cool device to have. Something like a white cane. These are Trex bone conduction headphones that makes it so you can hear through the bones in your ear instead of through your ear canals. That might be especially helpful for someone who is blind and wants to be able to listen to something like directions on their phone or something, but still have their ears open to hear what's going on around them. Or for some folks with certain kinds of hearing loss, they might be able to use these. We have lots of different kinds of alarms and alerting systems. This is a bed shaker alarm that would vibrate, that little round circle would vibrate for someone who has hearing loss that could wake them up as an alarm. This is a Braille label maker, and we have all kinds of magnification devices. There are a ton of different magnification options, and this is just one of them.
So we love devices for thinking and feeling. You know, we are advocates for all things fidgets and sensory devices. So you can see there is like a little fidget cube. There's so many different types of fidgets out there, and we encourage all of them. There's also noise canceling headphones, which are really great to block out a lot of sound. There are different toys and lights and things to kind of modify our environment to maybe make that environment more comfortable for us. Weighted lap pads or weighted blankets. We call that little circular thing on the bottom of the screen a wiggle cushion. So it's just like kind of like an air, like almost like an air mattress, but like in a circle cushion that you can sit on. Different kind of just like visual fidgets and visual things that you can like turn around. These are all things that we highly encourage. We also in our lending library have a sensory kit. So we understand that a lot, like ordering all of these devices would be like, what, $50, $60? Not everyone has that type of money. So we encourage people to just test out what they want from our lending library. They're more than welcome to borrow that as well.
Yeah, and then we have lots of devices for communicating. We have a speech therapist on staff who's really wonderful at figuring out what works for people, but there's all kinds of, you know, the whole range of the continuum, from a light tech device, like a one button that you could press that would be recorded, and you could press the button and it would say something, to a Skyle, which is an eye gaze bar where you can use your eyes to select words. Maybe it's something like text messaging or something on your an iPhone. Maybe it's a robust communication device on your iPad. This is like an electrolarynx on the bottom here to help someone who needs to communicate with their voice. And then, as I mentioned, this is like a Go Talk. We have all different kinds of Go Talk devices that have like 4, 6, 10, 12, all different numbers of icons. So you can use that kind of more mid-tech communication device. But if you're interested in learning more about communication, we have a communication website, like a specific page related to communication that we can share out. And Haley, our colleague, is really wonderful at explaining all the communication devices. All right, so we'll talk a little bit about our programs, and we'll share kind of, generally, so you can learn about our specific programs, but also what may exist in your state as well. So as we mentioned, we have the Assistive Technology Lending Library. So anyone in Pennsylvania can borrow anything from the lending library, up to 5 items for about 5 to 9 weeks. It's totally free. We ship it out to you for free. When you're done with it, you put on the return label and ship it back. You don't need a prescription. You don't need a letter. Whatever. You can borrow whatever you want. And it's supposed to really allow people to test things out, to borrow things, to use it and see what you really like. And every state does have some kind of lending library, so people can try and use assistive technology. I'll just give you, actually, this is the Obi robot. I'll give you a quick little Obi robot watch party here. Let's see.
We are unable to hear the sound.
Oh, you can't hear the sound? Okay. Is it helpful to watch or no?
You can reshare it with the sound. You just have to stop sharing and then reshare and click the little button that says share the sound.
Got it. Okay. Well, to save time, I'll just show you the video for now, and I'll actually mute it and I can talk over it if that works. So this is that Obi robot device, and you can't quite see this yet, but I'm using 2 switches to scoop using the spoon, and then it brings it to my mouth. And I had already taught it at this point, like where the angle was of my mouth so that it could reach me. So you're seeing here that little black switch on the table. I already pressed the button. Now it's just, I'm waiting and it's bringing the food toward my mouth. It's a very cool device. We also have another computer access kind of thing, this laser keyboard that can kind of laser the keyboard onto anything, wherever you are. So I think especially helpful for someone who's maybe using their phone and needs to, use it out and about, or perhaps sometimes just typing in those keys is just like, really can be challenging on your hands, especially if you have arthritis or whatever, pain and fatigue in your hands. So something like that, then you're not having to press any keys. So that's pretty cool too. So we'll quickly just share some things that are in our lending library just to give you some ideas of like, oh, that's something I would like to maybe try. And I can see if it's in my lending library, or if you're in PA, you can borrow it from us. So I'll let Tom kick off. We'll go through it pretty quickly because I want to save time for questions. So we'll just glide through.
Totally. And a lot of stuff we already covered, but we have a ton of switches. If you don't already know, there are like multiple types of switches. On the screen, we have a Bluetooth wire switch. The second one is an iPad 2 like double switch that connects to iPads. The last one is a proximity switch. So you just like swipe over it and accesses versus actually touching it.
And just a quick, to bring it back a step. So switches are a way to basically interact with things if you have trouble interacting otherwise, whether that's paralysis, difficulty with fine motor, whatever that might be. Switches give you an opportunity to interact with the environment around you. So something like a Bluetooth wireless switch you can use with your iPad, and you can watch it scan through and then select when, picture like Spotify, it's going through all the songs, and when you see it get to the song you want, you can click select. Or something like a 2 switch, you can use one to be going through the songs and then using the other one to select it. So for someone who maybe is using a gross grasp, like maybe you can't press the button with one finger, maybe you're just hitting it with your elbow or the side of your hand or something like that, or your head or your knee. Lots of ways to interact with the world when you're using switches. We also have lots of different phones, especially because we run the free special phone program for Pennsylvania. And there are tons of different phone options with like captioning and volume controls. And I don't even know. I need to learn more about the phones in this program. I haven't been intimately involved in this one, but there are so many phones. I feel like both landlines and mobile phones for people who hard of hearing, someone who has vision loss, someone who has a physical disability. There's like so many different options, large print, whatever. There's so many phones available.
Also, like different alternative like external devices that can be attached to the phone. Like really, we have a lot of stuff. We do have some hearing devices. Hearing devices is really hard because, like we said, hearing aids are super helpful, but we do not do anything with hearing aids in the state of Pennsylvania. I know North Carolina does a lot with hearing aids. We personally don't. We do have personal amplifiers. So like we have on the screen as a pocket talker. We do have different types of alert systems. On the screen, we have a bed shaker with an alarm, which flashes lights, but we also have, you know, doorbells that flash. We also have fire alarms that flash. PA is a really good state to get people connected to flashing fire alarms. And last, we have these bone conducting headphones. We put those bone conducting headphones in the seeing and hearing category, right? A lot of times, because if you are deaf, right, you have inner ear deafness, but you might have some functional hearing in your bones, those headphones would be great. Additionally, if you are blind and you want to like navigate the world, you're crossing the street, but you want to hear your GPS, you can have the bone conducting headphones that then lead to your inner ear to be able to hear like traffic, basically. So these are some great hearing devices.
Lots of eating things, which I've already mentioned. The OB dining robot, the lift to our level spoon, and easy hold cuffs that can hold utensils.
We love adapted toys. So we have in our lending library a bunch of different toys like the Buzz Lightyear, Nerf guns, things like that that are already adapted so that all you have to do is plug in a switch and then it works. We also make a lot of toys adapted. So, but we'll get into that in a little bit.
We have lots of things for dressing and grooming, little things like a zipper pull or the nail clipper holder, we do have a nail clipper holder in our 3D print catalog. This is an automatic nail clipper. But also things like a smart home kit might help. You know, you could create reminders and alerts for like the order of getting dressed or things like that. I think that can even be used for dressing routines, grooming routines, smart home devices. I want to stick around for that presentation because I think they have so much potential.
We have a lot of kitchen tools. So we have a one-handed cutting board, like we mentioned. We think automatic can openers and jar openers are just like generally super helpful for a lot of people. We also have some different type of like cutting options. One of them that we have in library is a kitty cutter knife, which is just like a safer way to use a knife.
Lots of leisure things as well, like I mentioned, the Easy Grip gardening tools, the tactile music interface, and then the Xbox adaptive controller. I'm going to skip through computer access because we already talked about this. We talked about communication. We talked about sensory. Tom, share about apps.
Great. So if you're like me, you get overwhelmed with a lot of options. So instead of just continuing to be overwhelmed and just curious about apps, we created a blog, like just a post about apps. So it's apps categorized by functional need. They're all low to no cost apps. It's on our website. The link is here, and I'll put the link in the chat in a little bit. But yeah, there's so many apps that are out there, and a lot of those apps are super low cost. And so we encourage anyone who might want to use their phone as an assistive device to go there and figure out if there's an app that might address your need.
All right. I'm going to skip over this. We do demonstrations in Philly, and every ATAC program, as we mentioned, does do demonstrations of assistive technology. This is a picture of our demo room at Temple University. So we often will bring folks into our demo room to show them all the different options, work through it, figure out what works best for them, or we can do it over Zoom. So this can be something that you can do maybe with a clinician or just a person or a family member, whoever can be a part of these demonstrations so we can show you all the different options. This room is a picture of our demo room. It has all kinds of stuff out like switches, our 3D printer, a big TV, magnification, lots of stuff in this room.
We do technical assistance. Most states will also do this. And so if you're working in wherever you are, I do personally website and document accessibility checks. I do a lot of audits. I'm working on 2 right now, just because I happen to know a lot about that. We also do accessibility assessments of physical spaces and even social programming. So the image that we have here is the Honors Lounge, the Honors Program Lounge at Temple University. Alanna, I, and our friend Izzy went there and did a little assessment of the space. We also have someone on our staff that does a lot of emergency preparedness audits, and so like creating a plan in case of an emergency to address all of the needs of everyone in that space. We also just deal with general inquiries regarding assistive tech and accessibility. So you'll find that most programs across AT Act programs will do this. It's kind of one of our mandates from the federal government.
Yeah. We're also, this is a new thing that we're doing in Pennsylvania, but maybe it'll take off in other places. We are starting something called the Wheeled Repair Alliance. This is in its infancy, so stay tuned about how it all pans out. But our goal is to develop a network of bike shops and mechanics who have expertise to repair and maintain wheelchairs and mobility devices. We also want to train wheelchair users to fix and maintain their own devices. And we're going to be providing the necessary tools to these people for free. So whether that's like a tire pump, or any kind of tools that they need to tighten casters or deal with repairs. We've really seen a lot of people frustrated with how long it takes to get their equipment repaired from the vendor. This is, of course, perhaps something more for people who either don't have a warranty or don't care about their warranty. For example, we have a reuse equipment program, which many of the states have. And so we often give people manual wheelchairs for free. We donate, we get donations and we give them back out. And so those people don't have a warranty on their chair and they often need things to be fixed and they want it to be fixed quickly. And so we're really trying to create a network of people who can do these fixes because they already do for bikes and things like that. And so we know that they can do this for wheelchairs as well, and to teach people more about fixing their own devices. So that's something that we're going to be kicking off in the next month or so. If you're interested, if you're in the area and want to get involved with that, please let us know. This is a photo of some folks hanging out. They are wheelchair user bikers, all outside. We'll talk briefly about our experiences with making assistive technology, and then we'll wrap up and happy to take any questions that you have.
So we have a program that we call Create Together, and we use 3D printing and other kind of like DIYing means to create assistive technology for free for people in Pennsylvania. So we have a 3D print device catalog. We have individual kind of one-on-one projects, which we don't do nearly as much, but it's just very complicated. And we also do large maker events. So here is just like a little kind of like a couple of images from the maker's catalog, as well as a link from that maker's catalog. So we'll 3D print different kinds of ways to use a pen. So right there we have a ball pen. We also have a universal cup with a pen on it. Kind of a key extender, an adaptive stylus. We'll make our own switches, as well as universal cuffs. We have about maybe 25 or 30 devices on that catalog that we will 3D print and ship for free.
Yeah, and as Tom said, we sometimes do individualized design projects. So we'll maybe collaborate with OT students or engineering students and people in the community to create things that they need, like a floor wheelchair that was made out of a bumbo seat and a cutting board, or I sew some things like ostomy covers. We made this PVC beach wheelchair and a PVC walker for a little kid. And then we also print key guards. We 3D print key guards, which are pretty specialized for certain communication devices. So all of these projects have been really rewarding and fun, and we always hope to do more of them, but they're definitely a bigger lift. So we don't get to do them quite as much.
Something that we like to do is we find a lot of success with like 3 to 4 hour chunks of time where we just get a ton of people in a room and make things. So we've been doing this for 3 years now. We do an adaptive toy drive where we 3D print and make switches and battery interrupters, and we adapt toys that have batteries in it and give them to children for the holiday season. So around November to December time, we are giving away these toys. And we have a little TikTok there. I don't know.
Yeah, I'll just play it. So this is our 3D printed switch with a penguin toy. Here's one of our printers actually printing the switches. Here's Tom taking all of the toys over to the engineering building so we could work on adapting them. Here's all the supplies, 3D printed things, wires, setting it all up. This was with the engineering students at Temple. It was pretty fun. So we're doing that again this year. That's going to be happening in the next month or so. So maybe, Tom, if you want to put that link in the chat, we're going to be getting that going very soon. Exciting. We also think it's fun to like make things out of very things from the dollar store or whatever, like pool noodles. We also use this material called Instamorph, which is a moldable plastic that melts at a pretty low temperature. You could make like built up key holders or a pencil grip or a utensil holder. There's lots of things you can make with Instamorph. It's really fun. At this organization, Makers Making Change, is all over North America. They're based in Canada, but they have local chapters all over the country. So we are the local chapter of Makers Making Change in Philadelphia, but we just wanted to share out about this program with all of you because there are likely chapters in your area. So if there's something you need that could be 3D printed, we recommend checking out Makers Making Change. We'll pop that link in the chat as well because often there will be someone in your area who can 3D print something for you and get it to you. Sometimes you have to pay like shipping or material costs, but it's a great resource to be aware of that usually has chapters all over the country.
Definitely. And we're starting to find that like more AT-ACT programs are being inspired to do 3D printing. And we've actually one-on-one kind of like worked with multiple states, and we're currently leading this like national conversation about 3D printing. So we have several states that are really getting started and really interested in 3D printing. So I know if you live in New York, they're pretty robust. Oklahoma is really robust. Who else does like?
I think Texas.
Texas is really getting into it too. So like some ATAC programs are doing it, but it's not a required aspect of the ATAC program. Sorry.
Yeah, no, that's great. So now we're wrapping up. So we wanted to share our contact information with you. If you want to reach out just about anything general, you can reach us at TechOWL@temple.edu or give us a call. We also have a chat function on our website. If you want to just chat someone who's on the website, we can usually answer some quick questions. You can follow us on social media. We always love sharing about the things we are discovering or, devices or ideas that we're think are helpful and effective for disabled people. We really are trying to destigmatize assistive technology and make it like cool and awesome because it is like glasses and whatever else you might need to participate in the world around you. It's cool. And so we want everyone to be able to use it and learn about what exists. So often we'll get a comment on, we'll share a video of a new tool and someone will say like, oh my God, literally didn't know this existed. This might change my life. So we're trying to have as many of those moments as we can. So you can follow us on Instagram, Facebook, TikTok, Twitter, and LinkedIn. And Tom, you want to beg for survey data?
Yeah, I'm super good at begging.
Yeah.
So because we are a federally funded nonprofit organization doing this work, we are required to report when we do presentations. So I beg you all to please take out your phones. Alanna, may you please put the link in the chat as well. So we need your data. We need to know how this presentation was, and we need to prove to the state that we did this. This is a free presentation. We do these presentations all the time. And we also look at the feedback, and Alanna and I text each other about the feedback. And so we always are trying to improve our presentation style. So we really do encourage you all to take the survey and be honest and let us know how you feel about this. And then also so that we can report to the state that we did this and get our funding renewed. That's also very important too.
Yeah. And so now we're happy to take questions. I'm going to just stop sharing. And it looks like there might be a few questions in the chat, but I don't know if Marissa, if you want to like guide questions at all.
Yeah. Thank you so much, Tom and Alanna. Such great information. I mean, I didn't even know half of those things existed.
There's so many things.
Yeah, so thank you so much. It did look like there were a couple questions. Somebody wrote in, understanding everyone's situation is different. Is there a list of preferred adapted devices over others? For example, this person finds the Alpha Grip keyboard helpful, but knows it might not be helpful for everyone. So are there any kind of lists out there to help figure out what devices are preferred?
I don't know about preferred, but there are definitely like places where you could just discover new things. I'll put it in the chat. We have a tool called the CATS tool, which stands for Considering Assistive Technology Solutions, which is basically, what'd you say?
I put it in the chat, yeah.
Oh, cool, thank you. I was just kidding. Basically just a way of like, you know, sharing what your challenges are and your strengths and what you want to do, and then kind of figuring out, it'll kind of populate a list of like, here are some things you might want to check out. I always like just like going through our lending library and discovering what's there, but yeah, I don't know about preferred things. Otherwise, I think I found it really helpful to just follow people on social media and see what they like. I feel like I learned so many good things from that. Did that answer the question?
Yeah, I also think too, like the super interesting thing about AT is that something might work really well for someone who might have a very, very similar need, but it just doesn't work for you. And I think part of the reason why we stress about the lending libraries across the nation is the only way to really know if something works is if you try it, and if you feel it and you feel how it works for you. AT is super specific and individual.
Great points. Another comment came in, would you be able to host a session in the future on how to set up features on your iPhone or your laptop? So I don't know if that's something TechOWL does. Do you ever walk people through how to set up the accessibility features?
Yeah, for sure. Yeah, maybe we can coordinate a session about that. Maybe, yeah, that I do think that would be, I just recently switched some accessibility features on my phone because the contrast was poor. So I switched them. Yeah, that's something we think about and do all the time.
We have a presentation titled How to Make Your Phone Work for You that we provide on a semi-regular basis. I would say like maybe every 2 or 3 months we get someone that wants that presentation.
That's great. Something I think everybody could probably use.
Yeah, for sure.
So wonderful. And then another question came in from this individual. They have it says, do you think there might be a way to connect a bed shaker to an IV pump, so that when the IV pump alarm goes off, it shakes her bed to wake her up, because sometimes she sleeps through the alarm and then blood sugar drops and it just becomes a cascade of challenges. So
that's a very good question. I want to say it's possible. It's not possible for me to do that personally, but like that feels very possible. I feel like people are always coming up with like wild things. I will say, check out the Makers Making Change site. There's a way to, there's like a forum where you can post sort of like design challenges or design, you know, like frustrations or whatever. And then sometimes someone will offer to sort of solve a challenge. Someone posted something recently about like being able to put in earrings more independently or things like that. So that's a place you could put in that. There's also some cool like assistive tech pages on Facebook that I follow that often people will post stuff like that. Maybe I'll try to put that in the chat, but I feel like that should be possible. I don't know. What do you think, Tom? You're more like that kind of brain.
Yeah, the biggest thing that I know is I know how bed shakers are kind of attached to their clocks. So there has to be someone who's rigged it. Like that's like something like I'm sure on Reddit somewhere someone has made this happen, but I don't think that it's very well known. So I'm just gonna pop my email in the chat, and you're more than welcome to reach out, and then maybe we could talk about that more.
you seem like good people to be able to find some hacks.
Sometimes
figure out ways around different things. So
we try for sure.
Looks like there was a hand raised, and I'm sorry. I know when hands are raised, unfortunately, we can't unmute. But if you're able to put it in the chat, your question, it looks like, oh, there's a question. Can we rewatch this? Absolutely. We are recording all of the presentations, and in a couple weeks, you'll get a link so that you can rewatch everything. Another question came in, are we able in Michigan to contract or find companies that would be interested in the 3D printing and robotics? I know my son's fingers are on the weaker end, so gaining some strength with play sounds fun and exciting instead of the frustration.
Oh, that's a good question. So it sounds like maybe you're interested in actually like the like learning about 3D printing and stuff maybe, which would be very cool. I'm gonna link you to Michigan's ATX program here because you should definitely reach out to them. Are they doing 3D printing, Tom? Do you remember?
They're doing 3D printing, but more importantly, they're doing accessible gaming.
Oh, right.
I love
Yeah.
accessible gaming out in Michigan. So
Yeah.
that might
I don't
be
know where you are based compared to where they are, but oh cool, he's a gamer. Lovely.
Ah,
You should definitely talk to them. Yes. Yes, I know. My head is always, someone said they're new and there's so much info and your head is spinning. Yes, I agree. My head is constantly spinning with all the new tools. I feel like I can't like I learn one new thing and then there's like 19 different other things that I should have learned about.
yeah, a lot.
So yes,
I
I think what?
I was just gonna say I have a kind of a question is what how do people even know where to start with what they need? Like there's so much out there that it can be
Yeah.
kind of overwhelming that you don't know where to start. So what do you
Totally.
suggest people do?
So sometimes we just meet, like I met with someone yesterday who didn't really know where to start. She was just like, "Oh, I heard about your organization and I'm, developing disabilities in my older age." And I just wanted to, and we just talked for a little while about things that might be helpful or, whatever. It was very like open-ended. And we just chatted for a while about things we might have that, like, I was kind of asking her questions about, oh, what is this like for you? Or, so it can be kind of open-ended. And that's something that every ATF program can do. They can set up a time to talk to you and just like explore. I think for a lot of people, like you don't know what you don't know. And especially when you've been doing something a certain way for so long, you might not even realize that you're having trouble with it or that it could be easier for you. So sometimes you just need another mind on it. Tom, any other thoughts about like where to start and how to not get overwhelmed?
Yeah, I like constantly find that Alanna has to make me feel like not like a poser often because I just like my brain is so overwhelmed with all of the devices at all times. But I think Alanna, you're really correct on just like reach out to your state AT-ACT program because we have these conversations every day, all day. And oftentimes like we'll get like comments like, what's the best device for Ehlers-Danlos syndrome? And we're like, well, really, like, let's talk about what that means. Like, what task do you want to do? And like a lot of times it is a conversation that requires a lot of just like, let's feel out like what you actually want to do and like what you think could help and what exists in the world. And so it's a lot of iteration.
For sure. I know we have to wrap up because there's
That's okay.
I was just gonna say someone asked about the phone survey. So I'm putting our phone thing in the chat. That's our phone program in Pennsylvania. You may have to do some exploration to find the Ohio version of that.
So it is called the Telecommunication Device Distribution Program, which just is a mouthful, but it is a national program. So every state has this. So it is like it is a national thing, but every state does it very, very differently.
Yeah, so you might have to do some exploration there.
There was another question in about fall detection technology. So people that are falling.
Yeah, we have a few in our lending library. We have a few like alerting devices, like something that you could like indicate to someone, like press a button if you fell or had an emergency or something. We don't do too much with that. Maybe that's like an area that we might need a little bit more conversation about. But our colleague Caitlin, who does a lot of work on emergency preparedness, is also knows a lot about like alerting subscriptions and devices like that. So she is always our go-to for those kinds of things. I think it's a little complicated because of the subscription nature of those things. It's harder for us to like lend out those kinds of things, but she has a lot of great resources on that. So you should definitely get in touch or chat us on the website if you want more information about that.
Yeah. That's great.
Yeah. Oh, I'm just gonna put the oh, thanks, Antoinette. That's really helpful. I'm going to put our survey in the chat one more time to encourage you and entice you.
Oh, Antoinette, that's it. That was the link I was looking for. You're awesome.
Yeah, I couldn't find it at all. So, oh shoot.
Awesome.
Oh, okay. I think it just you're going to like an external site with that. Okay, great. But I think it works. Yes,
Okay.
please get in touch with us. You can email us or chat us or message us on Instagram or Facebook or whatever. We're always excited to share and learn from you all too. People message us all the time, like, "Oh, I just saw this device. Have you seen it?" And I'm like, "No, another thing to learn about it." So it's always great to like see what people are checking out.
Absolutely. Well, thank you both so much.
Yeah.
I was going to also just suggest to people too, if you're seeing like an occupational therapist or even sometimes a physical therapist, they often might know as well about some
Yeah.
devices that might work best for you. But definitely getting in touch with, and I'm sorry, it's your Assistive Technology Act. Okay.
Yeah.
Yeah.
Because it was it's around the time of the ADA that its AT Act was passed to ensure that every state has these resources. So it's like a legislation.
An actor. Okay. Gotcha.
Yeah.
Well, I think that's a great first step and something that I don't know a lot of people that a lot of people know exists. So it looks like we have one more real quick question come in.
Yeah, for someone who has no use of her hands. Yeah, there's lots of like voice control options as well if she can use her voice to control things. I think there is actually a landline phone that has voice control.
Yes, there is. And for the smartphones, right, you could use your Apple phone and create custom voice gestures. If your mom has an Apple, like an iPhone, for example, go into accessibility features, go into controls, and then you do custom voice gestures. Like you can literally create the like tap the phone to wake up the keypad, and then a custom gesture to do the keypad code, and then it opens. You could do swipe gestures, you could do slide gestures, all through your voice. And so you can get really creative with an iPhone, and it's all free.
Awesome. That's a great tip to end on. So thank you. This has been so informative. And so thank you, Tom and Alanna, for sharing your time and your expertise with our community today. We really appreciate it.